Hello everyone, and welcome to another audio and podcast in this series, the LabZtorm Impact V2. This audio podcast is going to be an overview on a topic that has been sort of surmised in a previous audio podcast in a different Storm Robotics production. However, I'm going to make a bit more emphasis and actually highlight the works around this audio around this topic in this audio podcast with a bit more elaboration, really. That once again, this is the Shientist, and it's a Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG, and this is in the series the LabZtorm Impact V2. The topic that I'll be highlighting is about renal health awareness or renal awareness, but I'm going to provide an overview and linked to the Lord Mayor of Bristol, the Lord Mayor a link to the Lord Mayor blood and organ donation campaign that actually took place as an initiative in line with the Lord Mayor, one of the Lord Mayors of Bristol, between 2014, 2015. This work has been published and it is available through the Renal Patient Support Group, the RPSG. So I'm going to provide a bit more sort of contextualized overview around this, because it is works that have not really been highlighted from a sort of a perspective where research is research from an initiative practice, a research initiative practice sort of a viewpoint has been sort of has been sort of put forward. The main works also around this has been published through an organization known as NHS Blood and Transplant around the same time, back in 2014 or 15 or thereabouts. However, the context around the renal patient support group, the RPSG, had not been highlighted within the NHS-BT, NHS blood and transplant, NHS blood and transplant report. So I'm going to start off by providing a little bit of background, some context around the objectives, and I am going to highlight some of the activities that took place around this, alongside with highlighting a few of the sort of the collaborators in this work and who have been listed as collaborators in the publication. So this was the Lord Mayor of Bristol's blood and organ donation campaign, and it was an initiative really to bring colleagues and collaborators from different ethnicities together to actually prompt more more signatures really relating to a blood and organ donation. And so to begin with, I'm going to highlight this. So work promoting the need for increased blood and organ donation from Black and Asian and minority ethnic communities is ongoing, and a campaign in Bristol has been fighting the cause. So So in this works, there's a description around the objectives and the outcomes of the project and approaches as part of the initiative. If anyone wants to, actually look at works around this, there are certain terminologies you can actually search through a basic search engine online. So I'm going to highlight the main terminologies would be, for example, organ donation, transplantation, blood, campaign, community, Black, Asian, and minority ethnic, or BAME. So it was in September 2013, a health awareness campaign commenced in the city of Bristol and involved 5 influential organisations. The Lord Mayor of Bristol set out to highlight the importance of blood and organ donation in Black and Asian minority ethnic communities who are still not completely aware of how these donations can save lives. Ultimately, the campaign aimed to increase the blood and organ donation pool in Bristol's Black and Asian minority ethnic population. In this article, or in this overview, the authors sort of highlight and summarize 7 main campaign strategies, and the strategies are in relating to the following. So there's education, there's awareness and promotion, the science behind blood transfusion and organ transplantation, ethics, religious and cultural beliefs, taking ownership, and reporting and dissemination. The Lord Mayor's campaign helped to raise awareness and inviting members of the BAM communities to sign the blood organ donation register. The work of this campaign has been extraordinary, and I will highlight one of the main outcomes of this after I've talked a little bit or highlighted a bit more about the different different objectives. So following the publication of the All Parliamentary Party Kidney Group, or APPKG, and the National Kidney Federation, retrospectively in 2012, its manifesto on improving kidney donation and transplantation in BAME communities, and the Faith Engagement and Organ Donation Action Plan, which was published by an academic around 2013. The Lord Mayor's campaign aimed to encourage people from BAME groups to sign up in greater numbers to the blood and organ donation register. The campaign took place in collaboration with the Bristol Multi-Faith Forum, the Renal Patient Support Group, the RPSG, NHS Blood and Transplant, NHSBT, and 2 radio stations. One was named one of the radio stations was Ujima Radio 98 FM, and Bristol Community FM at 93.2 FM. And the main objectives were thus: to advise on issues related to cultural and religious sensitivity, publicize the campaign broadly to BAME and faith communities, promote the campaign using community leaders, develop and roll out community champions, and assist the community champions in undertaking their role, and then also support community events and forums. So 7 main strategies and seven main sort of strategies were part of this, and I named them briefly, but I am going to highlight some of the things that took place because generally speaking, And believe it or not, even when I go over this work, and this was back in 2014, between 2013 and 15, I still get overwhelmed actually to actually really appreciate sort of the involvement that took place. So some of the so around education, for example, there was a need to increase a BAME community's understanding of the role of organ donation registries. So in context for so in context in that context, for example, in relating to population health and epidemiological sort of investigations and studies. So in the UK, there are two types of registry: donor and non-donor. And so the activities around this was that the main objective was was fulfilled through sort of broadcasting and web conferencing workshops and publications. In September 2013 and February February or March 2014, the Lord Mayor of Bristol at that time and the campaign collaborators took part in a live debate on blood and organ donation on a community interest radio station, and that was through Yojima radio station 98 FM. With further follow-up interviews in 2014, in which a patient and carer and donor coordinator from the North Bristol NHS Trust discussed their perspectives and experiences. The Lord Mayor and campaign collaborators were also interviewed on another community radio station, BCFM, Bristol Community FM 93.2 FM, in September. In September 2013 and February or March 2014 during a program highlighting the need for Black and Asian minority ethnic individuals to join the organ donation register. So then on World Kidney Day 2013, NHS Kidney Care as an organization in its own individuality unfortunately does not exist anymore. But back then in 2013, NHS Kidney Care hosted a series of e-learning on acute kidney injury and organ donation and transplantation awareness. Two community champion training workshops took place in the same time, hosted by Southwest Organ Donation and NHS Blood and Transplant teams. Articles were written and published to follow the radio events. Two campaign champions talked about their experiences on waiting for a transplant on the BBC Points West News. And finally, a stand was organised at Bristol City Hall, where the NHS Blood and Transplant blood donation team raised awareness on blood and organ donation in Black and Asian minority ethnic groups and provided visitors with information on the Lord Mayor's campaign or initiative. So that's some context around the education side of things. Now I'm going to talk a little bit, or highlight a little bit around the awareness and promotion side of things. So given that there are now novel methodologies to promote health awareness and education through the internet, these were explored and of course exploited. So activities, for example, included where to record efforts to promote the campaign through the renal patient support group, and invited members of the campaign support group to complete a 1 month diary. So on World Kidney Day 2011, the British Kidney Patient Association, BKPA, back then. Now the BKPA has changed its name, has gone under a sort of a revamp. It's no longer known as the British Kidney Patient Association. It's now known as Kidney Care UK. But back then in 2011, around in support of World Kidney Day 2011, and the renal patient in relating to the renal patient support group RPSG jointly sponsored a social event, a bowling tournament, and all participants were wearing T-shirts with World Kidney Day 2011 logos, and two fact sheets were distributed to the public. So in 2014, the Lord Mayor addressed a British the Bristol Multi Faith Forum Health and Well with the Bristol Multi Faith Forum a health and well-being event. And in the same year, an awareness day was held at a major shopping centre in the southwest of England, and this was based specifically in the Bristol Southwest region, in which members of the public were invited to join the blood and organ donation register. Campaign collaborators distributed literature to the public and were available to answer specific questions about organ and blood donation. And so moving forward, with various forms of social media available, many of which have been freely available, different types. It's been highlighted here that different types different types of social media should be used more sort of effectively to enhance people's understanding of the science behind blood transfusion and organ transplantation. So now I'm going to talk a little bit about the science behind blood transfusion and organ transplantation. So the challenge is to provide accessible literature in a variety of languages for patients and their carers in the UK's multi-faith communities. So scientists and clinicians also in part with this need to interact better with this community, or those from multi-faith communities, to provide a more effective health education. So a bit of background around what happened in context around the science behind blood transfusion and organ donation as part of this campaign and initiative. So primarily the workup of prospective primarily the workup of a prospective transplant for a recipient is through what's known as immunological based assays to determine antibodies through the recipient's human leukocyte antigen, or HLA system. And there are publications up and down globally around the human leukocyte antigen. If a serum sample is tested against a panel of white cells from donors with a range of different HLA types, it is possible to identify specificity of the antibodies from the reaction patterns with cells carrying different HLA types. It is important for those from BAME backgrounds and broader society to understand the different concepts of the science behind blood and organ donation if there is to be an increase in donations. So the activities around this were thus. So in one of the World Kidney Day 2013 e-learning efforts, a consultant nephrologist active in all aspects of care of patients with kidney disease was invited to present insights on the science behind human organ transplantation. And in the same year, a blood tour was organized by NHS Blood and Transplant in an area in their main centre in Bristol, in Bristol Southwest. The event allowed the Lord Mayor and his campaign champions to get a better understanding both of the science behind transfusion and the effort required to ensure different blood products and quality assured and safety handled before being issued to different centres around the United Kingdom. So in a little in that time, the NHS kidney care in around that time or a little bit before, NHS kidney care. NHS Kidney Care and the Renal Patient Support Group (RPSG) did have a series of online webinars where there was a variety of health professionals as well as patients talking about different aspects of different aspects surrounding kidney care and nephrology practices. The works around that were presented at in and around a conference known as the Excellence. It was the Excellence in Pediatrics Conference, which was held in Madrid in Spain in 2012, where the data around the sort of social media aspects were highlighted amongst a sort of a European and international audience in Madrid, Spain. I'm now going to talk a little bit around the ethical theme that was part of this initiative. So when individuals are making a decision to go forward with donating blood or an organ, ethics always have a role to play. Health professionals should be actively disseminating key facts, main facts on organ donation process and engaging with the Black and Asian minority ethnic groups, BAME community, to ensure the information they receive on organ donation and transplantation alleviates any concerns or misconceptions. So the activities around this were thus. In addition to ongoing campaign activities, two health professionals were also invited to discuss the ethics and organ donation and transplantation during organized webinars in support of World Kidney Day 2013. And during radio interviews, there was a discussion about what more needs to be done to aid understanding of blood and organ donation pathways. It is evident that the media can play a greater part in the process. Many faiths support the principles of organ donation and transplantation and accept that organ donation is an individual choice. And there is various publications from faith perspectives as well as from public health based publications that highlight some aspects around that. NHS Blood and Transplant, or NHS v.2, has worked closely with work closely with religious with those closely with religious leaders, of those who are from faith leaders of particular faith, and those who are scholars from particular faith backgrounds, to produce a series of leaflets or literature explaining organ donation principles. These leaflets are all accessible and downloadable downloadable through the NHS Blood and Transplant website, at least historically, and have been since 2015, if not earlier. I'm now going to talk a little bit about the religious and cultural beliefs. And before I talk about this, generally religious beliefs is one thing, cultural beliefs is another thing. But in context, in this work, around the campaign, the two are actually in some context synonymous. So there is an increasing need to include faith in research on perceptions from a wider context, as has been the case in work by Abu Raya and team in 2009. Several studies suggest that to be successful, those implementing health changes and attempting to enhance people's understanding of blood and organ donation should recognize the role of spirituality. And I say spirituality quite loosely, but in generally to recognize the role of spirituality in community health and respect faith sensibilities and permit appreciation of blood and organ donation from the perspective of faith and community participation. And there's various publications that have highlighted some of the context dating back as early as 1997 and earlier than that, and so further to acknowledging the role of faith in donation behavior, it is important to consider the role of faith and community leaders. The term faith-based programs has been used to refer to faith-based health promotion programs that take place in a religious setting or are organized with the involvement of a faith group. The success of these programs is thought to be partly due to the partnership between faith and secular organizations. So a little bit some activities around this. The Lord Mayor at the time liaised with communities from all faiths in collaboration with NHS Blood and Transplant, the Bristol Multi-Faith Forum, the Renal Patient Support Group, and the radio station campaign collaborators to emphasize the importance of signing up to the register organ donation or blood donation register. A number of members from each community signed to donate and joined the organ donation register as part of the one of the outcomes or outputs from this. And I'll talk a little bit more about the outputs as I go through. So then there was a theme around taking ownership. So a little bit about this. So while there is now more evidence of communities becoming more aware of how blood and organ donation sort of helps save lives, more regional and national approaches can be adopted to enable practice to become more evidence-based. The Lord Mayor of Bristol's campaign is one that addressed the all-party parliamentary kidney group and the National Kidney Federation 2012's manifesto first quarter action point. The need manifesto's first quarter action point, which was to do with the need for more members of the BAME communities to take ownership and sign up to the blood and organ donation register. So a bit of some activities around in regards to taking ownership. So the introduction of peer professional education programs have been planned as part of the initiative of the campaign. This campaign that took place. So members of a community were provided with training and education so that they can share understanding and awareness about the importance of blood and organ donation with peers. Peer educators can either be contracted or volunteer their services. And there is works actually specifically from nephrology practices in some contexts around peer education dating going back to 2014 as well. It has also been sort of highlighted to have it was highlighted that there should be more sort of training implementation for nursing and medical staff as part of the NHS and National Health Service England's continuous professional development plan. Accredited continuous professional development could be based for example, at the Royal Society of Medicine in London to help health professional teachers and scholars to keep up to date on how to enhance services for individuals from different faiths. And campaign drivers and champions also had also been aiming to maximize use of social media platforms, example Facebook amongst others, during that time to report and disseminate activities. And just the point relating to the Royal Society of Medicine, as one of the co-investigators in this work, I did actually approach the Royal Society of Medicine to see if there's a route whereby there could be a theme relating to sort of this educational initiative around this particular work. And initial meetings, one of the initial meetings, one of my colleagues, one of the co-authors and collaborators in this work, and myself did, along with another colleague at the time, in the run up to this work, did have a meeting with another colleague at the Royal Society of Medicine, RSM, to actually see if there was a way to implement sort of an educational stance with and in line with the Royal Society of Medicine more formally. But unfortunately, we didn't sort of formalize that aspect of the initiative. It was unfortunately. However, now I'm going to talk about a little bit about reporting and dissemination. So the campaign aimed to implement social media platforms to disseminate ongoing activities through local and sort of broader organizations to increase support from Black and Asian minority ethnic communities. And so the activities around this were thus to meet reporting and dissemination to meet reporting and dissemination objective. The following media initiative had been postulated at that time. So that downloadable sort of PDF documents from local radio and collaborators' websites. And second to that was a full campaign report and notices ongoing. Notices that are ongoing activities through the Bristol City Council website, collaborator networks, and social media pages. So again, through Facebook, Twitter, etc. And then additional publications and presentations available through NHS Blood and Transplant website. And then a summary of this campaign presented at a one of the things was a summary of this campaign was to be presented at a European conference for all to learn from and potentially replicate a collaborative approach in other countries. And so the campaign outcomes around this, I'm going to talk a little bit about the outcomes, and I know I've highlighted a few points, but I'm now going to be a bit more specific around the particular outcomes around the different themes. So around education, the campaign highlighted the need to create educational packs to provide information about blood and organ donation and transplantation to Black and Asian minority ethnic communities. These educational packs would include literature and DVDs to allow community champions to educate communities on specific topics. Formal training would be provided by a trained peer educator. One of the community champions working with Ujima Radio at the moment, or has back in 2014 and currently, and is working as a started off as a community champion and now is a peer educator and has developed a peer education effort, which stemmed from the Ujima radio station. But in here, in this publication, one of the community champions working with Ujima Radio, is now involved in hosting a new show alongside an advisory panel. The future show will look to feature 2 or 3 patients every month who will be guests on the Ujima Radio to discuss experiences and to answer questions from listeners. This would result in an ongoing awareness and promotion of the importance of blood and organ donation in BAME communities. And now I'm going to talk a little bit about awareness and promotion. There were plans to provide an online platform where patients from various faiths and communities with different illnesses and their carers are able to share their personal experiences. Methods of developing awareness and promotion would include public meetings, personal blogs, and/or diaries, working with the local radio stations, and prospectively using additional sources of media, and for example television. There is still a need to educate lay people on the science behind blood transfusion and organ donation or organ transplantation in BAME communities, whilst ensuring information is accessible or made available in different languages. It's not documented here, not in this publication, but in different languages to meet health literacy requirements. And another thing that is not mentioned here, but to highlight that in related to the science behind blood transfusion, organ transplantation in BME communities. Some of the biggest challenges that are faced in relating to this subject, or the subject entity, is that when it comes to blood and organ donation, a big part of that relates to where the public from different communities, backgrounds, ethnicities, etc., have a hard time understanding, for example, what's the right thing to do, mainly because the science is the science behind blood transfusion and organ transplantation is a focus which is restricted by for example, healthcare professionals, and where health professionals, for example, are not readily available in the public domain, and are not ready, have never been ready historically, and even now generally have never been ready to talk to those from different backgrounds about the bases of the tests and investigations. And my work around this has conceptualized around this before 2012, before 2014, highlighting different aspects around the sensitive topics in this regard. And so generally the science behind transfusion and blood and organ transplantation, campaign collaborators have discussed proposals, have discussed ideas, and I can't take the credit for this. I definitely can't take the credit for this, because this idea was actually was something that one of the collaborators, who was a co-author. There were 2 main co-authors in this work, and one of them unfortunately died on the transplant waiting list. And I can't take the credit for this particular idea, but he highlighted when we were having a discussion about this, and he highlighted that collaborators should think about having sort of video interviews that aim to provide insight into the workup and preparation of different laboratory tests, to the extent where, for example, in mainstream media, that health professionals actually highlight those highlight the topics through mainstream media. So historically, at certain times, of the day, there used to be advertisements that highlight organ donation and transplantation through the media. For example, in media, there'll be someone who had for example, a road traffic accident, and the road traffic accident leads to someone having an organ transplant, or someone in the same circumstances might need a blood donation. And so there was media, there was advertisements at certain times during the day, during a typical 12-24 hour day, for example. And basically, one of the colleagues highlighted what would make sense and what would be better is health professionals actually talk about those things through mainstream media. And so collaborators have also prompted organizations of regular, in line with this, or part of this was that collaborators did put forward ideas, or put forward ideas where organization level, there should be regular or routine blood tours for people of all backgrounds and faiths to Europe's largest blood manufacturing and processing center in Filton, based in Bristol. And during the campaign, and a little while after, there was actually some success around that, where people were attending blood tours at NHS Blood and Transplant in Bristol. And then people who attended the blood tours would have also had an opportunity to ask questions about donation, the handling of blood components, and the science, any science behind blood transfusion and organ donation. And this also would help people to understand the ethical issues associated with any ethical issues associated with blood and organ donation. So on to this actually now, and I'm going to talk a little bit again, the next part of this audio podcast, I'm going to talk a little bit about the ethics. Now, I can't take a credit for the work surrounding ethics at all, because the ethics is actually works that actually stem from a particular organization, which is actually which has been GP, or a GP led, has been a general practitioner led. But I am going to talk a little bit about this. So the Center of Islam, or an organization. The Center for Islam, the CIM, is and was actively promoting ethics courses for professionals and lay people on blood and organ donation. Some of the events have had taken place during this blood and organ donation campaign, and some took place in a city called Birmingham in the UK, and some had taken place in a city called Leeds in the UK. And the CIM, or the Center of Islam, courses again were general practitioner led. So as well as courses dealing with the ethical issues sort of facing patients from different faith backgrounds, there were plans to introduce organ donation and transplantation consent questions onto medical administration forms. So, for example, a further opportunity may arise when considering the content of the do not attempt to resuscitate form, or the DNAR form. And one of the co-authors at the time in this work did have a general practitioner background as well, and the colleague and collaborator at the time highlighted that the DNAR form could be implemented in some way, and this particular ethics process should also initially be GP led, or at least there was discussions where discussions and general sort of perspective where the particular ethics process should initially be GP led, according to the General Medicines Council 2013 guidelines. So in summary, the guidelines state that in cases where health professionals assess that treatments or routine of care is unlikely to be clinically appropriate, they may conclude that cardiopulmonary resuscitation, or CPR, should not be attempted. So, for example, not be attempted in those who would be deemed as potentially brainstem dead following, for example, again, a road traffic accident or something else. And so some patients with the capacity to make their own decisions may wish to refuse CPR, or in the case of patients who lack capacity, and there is a whole host of literature around, for example, mental capacity, the ability to make informed decisions, etc. Generally in the public domain. However, in this works to highlight again, some patients with the capacity to make their own decisions may wish to refuse CPR, or in the case of patients who lack capacity, it may be judged that attempting CPR would not be of overall benefit to them. So before the point where DNA and CPR route becomes inevitable, health professionals should consider family consent and ethical issues in relation to patients donating their organs at the end of life. And so in context with this, some aspects around the religious and cultural beliefs in relating to some of the outcomes. So the campaign actively involved the Lord Mayor of Bristol at that time in 2014, who led certain events to invite members of the AME community to sign the organ donation register and give consent for blood donation. The events took place at venues such as mosques. At mosques, at Hindu temples, and actually at a gurdwara, and those many of the events in that context were organized through the Bristol Multi-Faith Forum. So there was some context where Bristol, in relating to this, there was some context where Bristol Multi-Faith Forums magazine already at the time before this publication came out back in 2014 provided a summary of this campaign, provided a summary of the campaign, and had been made available for viewing through the Bristol Mostly Faith Forum and Bristol City Council websites in around 2014. NHS Blood and Transplant, or NHS BT, during that time also looked to present a summary of the campaign on its website, and I believe it's still now obviously in 2022, and I believe it's still accessible if attempting to search for that. And so now I'm going to talk a little bit about taking ownership. So it was proposed, and I've mentioned a little bit about this. It was proposed that the Royal Society of Medicine had a formal faith in medicine or equality and diversity subsection. And as mentioned, there were initial meetings where my colleague and I actually attended the Royal Society of Medicine in order to actually put forward some sort of an education effort in line with this campaign, but also and before the campaign, the idea was actually to see that the Royal Society of Medicine, RSM, in London actually had a theme that related to faith. There's lots of subsections around different specialties and practices around clinical and general medicine, but there is actually no particular subsection that actually surrounds aspects of faith. And so the idea was to have a formal faith and medicine or equality and diversity subsection with CPD, continued professional development, accredited efforts in which health professionals present topics to students, faith leaders, and representatives from organizations representing faith and healthcare. And this initiative was also being discussed with colleagues at NHS England and the NHS England's Equality and Diversity Division. The Equality and Diversity Division helps to promote equality and equity, ensuring that healthcare is accessible and that no community or group is hindered. Improvements are made where necessary so that health outcomes across the country are continuously upheld. And as a local event, the Bristol Multi-Faith Forum is and was aiming to implement educational efforts for health professionals, patients, carers, faith leaders, and teachers with an intrigue in blood and organ donation as well. And finally, I'm now going to mention a few things about reporting and dissemination. So the main campaign report was forwarded onto the director of the Institute for Health Research at the University of Bedfordshire, who is and was the author of what was known back then in 2013, the Faith Action Plan. So in 2014, a summary of this campaign was presented at the Joint European Society of Pediatric Nephrology, ESPN, and European Working Group on the psychosocial aspects of children with chronic renal failure, EUOPA, conference that took place in Porto in Portugal. The presentation was received quite well, and the co-chair had reported the full report to be made available through the EUOPA website for all to learn from and potentially replicate again in their countries. Now, as I've said, I was going to highlight the main outcomes. I highlighted a few outcomes in relating to different aspects of this in the initiative. So to conclude, so over 200 signatures for blood and organ donation had been received from had been received from members of different faiths and BAME groups. This has been a remarkable was a remarkable achievement for that time, back in 2014, and the Lawmakers of campaign highlights the importance of faiths and communities interacted in the issues surrounding blood and organ donation. In general, what has made this campaign successful is that it adopted a bottom-up approach to ensure blood and organ donation awareness and understanding issues was addressed. The campaign had been developed through numerous practical educational activities, most of which enjoyed a high level of participation. If blood and organ donation if blood and organ donation supply and demand issue is to be thoroughly addressed, everyone needs to take ownership to ensure that communities are properly represented. And the Lawmakers campaign in Bristol, at the time, 2014, was an exceptional example. And there are a few main points I'm going to highlight in relating to this to surmise. So number one, the Lawmayor of Bristol's blood and organ donation campaign was in collaboration with Bristol Multi-Faith Forum, the Renal Patient Support Group (RPSG), NHS Blood and Transplant, and two local radio stations. The campaign aimed to increase the blood and organ donation pool from BAME communities. That was one of the main aims, and the campaign promoted the principle of taking ownership. Was underpinned by once again seven main strategies: education, awareness and promotion, the science behind the science behind transfusion and organ transplantation, ethics, religious and cultural beliefs, taking ownership, and reporting and dissemination. Finally, I just want to highlight that as part of the original meeting that took place in Parliament in 2012, as part of the NKF National Kidney Federation manifesto, and in line with the all party parliamentary group. There were representatives from CIM as well, the Center of Islam and Medicine, although at that time they were known as a different organization, and so generally speaking, there was a bottom up approach, but had this bottom up approach not taken place, believe me when I tell you, everything around this campaign would have been detrimented from a top down approach, because apart from this, there was no level of reporting from the works of different organizations that were in part of this campaign. What did happen was, for example, where I mentioned, for example, NHS Blood and Transplant did have a report, and there were those who were involved. Those who were involved did have the opportunity to have a photograph taken in that. But apart from that, there was no actual, for example, co-authorship and effort from that perspective. Finally, I just want to read out. I am going to read out the campaign collaborators and their affiliations, and these were affiliations at that time. At the time, so there was Maureen Omondi, who was a driver, champion, and administrator on behalf of the renal patient RPSG. There was Anisha Rashid, who was a campaign champion on behalf on behalf of the Renal Patient Support Group, the RPSG. There was Vicky Gardner, who is the co-founder and chief administrator for the Renal Patient Support Group, who was a campaign champion. There was John Gardner, who's a co-founder and chief administrator for the Renal Patient Support Group, the RPSG, and as a campaign champion. There was Fazana Sekar, who was a campaign driver and champion and development officer on behalf of the Bristol Multi-Faith Forum based in Bristol. There was so the Lord Mayor himself at the time between 2013 and 14 was Farouk Chowdhury, who was a campaign driver and champion linked with the Bristol Multi-Faith Forum, and again a Lord Mayor of Bristol under the Bristol City Council. There was Caroline Rodaway, who was blood donation and blood donation coordinator under NHS Blood and Transplant. There was Joanne Seddon, who was donor relations coordinator at NHS Blood and Transplant. There was Amanda Herman, who was an organ donation specialist nurse in the Southwest part of the Southwest organ donation team at NHS Blood and Transplant. There was Anusha Edwards, who was a consultant renal transplant and endocrine surgeon at that time at the North Bristol NHS Trust. There's Adibomia Layton, who was a joint campaign coordinator and community champion at the time under the Ujima radio station. There was Primrose Granville, who was a community champion under Ujima radio as well. There was Paulette North, who was also a joint campaign coordinator at Ujima radio in Bristol at Ujima radio. And there was a Sangeeta, someone known did a lot of work around this known as Sangeeta Dewan. Sangeeta Dewan, who was a broadcaster for Bristol City FM. And finally, finally, the main authors of this particular publication, and it is available through the Journal of Kidney Care, or JOKC, and its formal citation is the Lord Mayor of Bristol, Bristol's blood and organ donation campaign. It's known as the Journal of Kidney Care now, but when this was published, it was the Journal of Renal Nursing, and it's volume 7, number 4, and it was published in July 2015. And the main authors were myself as the lead on this. I was a specialist scientist and campaign driver, and the chief in research for the renal patient support group. So that was my collaboration. And then there was Sifal Kirbish, who was a campaign driver and there was Sifal Kirbish, who was a campaign driver and champion under the Renal Patient Support Group, RPSG. And there was at the time Filson Ali, a GP and campaign driver and champion, who was also representing the Renal Patient Support Group, the RPSG. I want to say thank you for taking the time to listen, and I apologize for the for the length of this, but I wanted to share this initiative. So this has been an audio podcast with the Shientist. It's been under the series the LabZtorm Impact v.2, and this was an audio podcast in relating to renal awareness, an overview linked to the Lord Mayor blood and organ donation campaign from 2015. It's a Storm Lab States collaboration with the Renal Patient Support Group, the RPSG. Thank you for taking the time to listen.